Hi there, my name is Lisa Dowling from the Cupping Revolution. I just wanted to check in here today and say hi and introduce myself to you and tell you a little bit about what we're doing here. So I am an acupuncturist and shiatsu therapist. I've been practicing acupuncture since 2007 and I first got into the world of bodywork in 1997 in Thailand when I practiced Thai massage. So it's been quite a long time. I first learned cupping in 1999 from one of my teachers in my shiatsu therapy training program. And we learned very traditional Chinese medicine fire cupping with glass cups. And I thought they were kind of amazing. For myself, I had a lot of chronic pain in my body, so sometimes I was feeling receiving cupping that the cups were a little bit uncomfortable for me. I've always been a practitioner who believes that you don't have to hurt someone in order to have a beneficial effect. Fast forward, a few years later, I started teaching at the Shiatsu School and also Acupuncture Institute, and I started teaching a number of subjects, and alternative modalities, including cupping, were one of those courses. So I continued to teach the course in the way that we had learned with fire cupping, using proper safety and cleaning protocols that we all learned in our acupuncture training as well, and it was great. I continued to do that for a few years until one day I had a realization. I was also teaching in a cupping therapy program that I kept saying to my students, these techniques, this is stuff you're going to want to do in clinic. This is the stuff that's going to turn you into a practitioner, not the stuff that's going to help you pass the test. And when I had that realization, I realized that I need to get out and start teaching practitioners who are already out there and working about how to use some of these skills. Fast forward again a few years to 2016. We had our amazing Olympics, Michael Phelps, showing up on the podium with cupping marks on his shoulder. At this point in time, I had already started to teach continuing education courses in a few different subjects, including Meridian therapy and acupressure and acupuncture points. It didn't occur to me that cupping might be something that we could take a little bit further as well yet, until I had discovered these sweet little bad boys called silicone cups. And I'm just going to talk to you a little bit about silicone cups because I find them quite fantastic, actually. When I first was introduced to silicone cups, I looked at them and I thought, they're kind of weird, you know, kind of like a, I don't know, a cheap replica of glass cups that they're just trying to make it easy for practitioners to do cupping so that anyone can do cupping. Okay, well, let's try them out. So I was a little bit opinionated about them. I tried them out on the body, couldn't really get a good suction with them, moved them around a little bit. They were all right, but I wasn't crazy about them. So I set them aside for a while, kind of forgot about them. And then, of course, cupping was getting more and more popular, and I was seeing this going on. And so I started to look a little bit deeper. I started to dig around and see what was out there, what was happening in the cupping world. And I was a little bit surprised when I started to see some of the things that people were doing with silicone cups. It opened up my mind a little bit, and I thought, you know what? I should give these things a chance. And so I brought them back into my clinic, and I started experimenting a little bit on my clients. They were kind of used to that because I was always bringing in some technique or another, and usually I was getting good results, so they were quite happy with me to experiment on them. And I was finding I was starting to move the cups around a little bit, starting to move the body around a little bit, and the cups, because they're silicone, they would stick. So I could do some great stretches and range of motion movements on my clients with the cups on their body, move the cups, move the body, and I was getting amazing, like incredible results. Huge increases in range of motion in just one session, massive decreases in pain in just one session, and clients were coming out of it feeling great, and they all reported that they felt lighter. I love that idea. In Chinese medicine, we talk about cupping, that it unblocks congestion, or they say relieves stagnation. I don't love that term, but it's really, really very true. So we look at ways physiologically to talk about that removal of stagnation. So whether it's unblocking the lymph, it's increasing blood circulation, it's helping to release scar tissue, it's helping with fascial adhesions. These are all things that cupping can help do, depending on how deep you place the cups on the body and also the technique that you're using. So I really dug in with these things and I started to play with them. I started to play with them with all kinds of different conditions in the body. I started using them for musculoskeletal pain, arthritic pain, acute injuries, chronic injuries, very, very different from how I learned in acupuncture school. In acupuncture school, really, it was all about learning how to get deep suction with the cups and putting the cups on as deeply as you possibly could. And if you got deep suction, it meant you were successful. All of a sudden, I was looking at 3 different depths of pressure and all the subtle nuances that you could suddenly do with these soft cups on different depths of pressure. So then I started working on people's digestive issues, their fertility issues, so even deeper stuff than musculoskeletal issues. And it's been incredible. And of course now I've been teaching cupping courses all over North America for the past 4 years, and my students have been my case studies. They're coming back to me and they're saying, hey, listen, we did this thing with the silicone cups and this is what happened. Further study, there's people all over the world doing so many studies on cupping therapy. There's a lot of research going on. A lot of research has already been completed. But I have to say that when I created the name The Cupping Revolution, it was a little bit of a play on words. I was really kind of poking fun at the fact that everyone was jumping on the bandwagon for cupping therapy. I was kind of jumping on the bandwagon myself, I'm not going to lie to you, but I was jumping on the bandwagon with my tools in my belt. I did a ton of research on cupping. I went into the history books, I went into current studies, I looked at what people were doing on the internet, and then I created original content. The content in these videos are original, amazing cupping techniques that anyone can learn. You can go on into the more advanced, what I call the masterclass series, where we go into specific conditions using the cups. And essentially, this cupping course is all about the silicone cups. There are a lot of the techniques you can apply with plastic cups and you can apply them with glass cups, but almost everything in this video training is done with silicone cups. Sorry about that, it turns out my video got cut off. I just wanted to say that I'm going to present you with a clip of video. Pardon me, I'm not that technically expertised. I did do the clips myself, so some of the edits might not be perfect, but the editing of the online course was professionally done. So I hope you enjoy some of the techniques I'm sharing with you. It's just an example of some of the many amazing techniques that you can use with silicone cups. So I hope you watch the video and enjoy. And running around, so we're following the intercostals and the pectoral muscles, and then out around the shoulder. Is it comfortable for you? Mm-hmm. Right at the top and the bottom of the muscle, and you just let them create a small stretch in the length of the muscle. And you can just leave them for a minute or two and you can continue work. People who are using these muscles a lot, the cups can get quite stuck in the area, and then I can go through a little bit of range of motion in the shoulder. I'm just going to do this 3 to 5 times. And I want to make sure that I'm really going slowly, especially in this case. So very light suction. You can see the suction is very, very light. So I'm barely pulling on the cup and it's coming off. And so as I apply this cup over the liver area, it is quite sluggish. So do you feel that kind of tight in there? So when I just move it around a little bit in this area, right, I'm having, even though it's that light, it feels tight. You don't think, because it's angular. And we have a bit of tightness in here. Comfortable?
Yeah.
So you always want to make sure that you're working in their comfort zone. So we're just going to work on this more. And you can see I'm following the path of the ribs. So really, the cup is of tightness that I felt here. When I run a smaller cup over the area, the cup is still coming off. So you can see here, it's a little bit restricted. The leg muscles can be quite tender, and sometimes when you go with 2 cups and you do cross fiber, it creates a little distraction. We can go up and down the leg, or we can also do cross fiber, cross the muscles with 2 cups. A line. So we talk about channel or line cupping. Now this is in Chinese medicine, this is the gallbladder meridian, and it tends to have an impact on our tendons, but also our overall flexibility. So it is quite an important area. So what we can do is we start off by placing some cups at either end of the IT, and then we just creating a line of tension along the entire area. So you could put a line of cups along the IT band like this, and then you could continue in this position to work on the peroneus. You could even do a little bit of work on the foot, or you could leave the cups like this for a couple of minutes and let them do their job so easily. The straightforward way of working on the IT bands is to place the cup with a medium suction and to glide it along the IT band. When I do this, I can feel there's a lot of restriction here. So I'm going to ask, but I'm guessing that this is not very. What we can do is we can do 2 cups and we can do a friction technique. So how do you like the video? Those are a few techniques that I teach in the online course, Cupping for Manual Therapists, and that's obviously in the face-up position. There's lots more techniques in facing down, working on the back, the neck, the legs, and we're also adding some little bonuses, treatment for the hands and the feet in the online course. So stay tuned. If it seems interesting for you, I'm going to be sending out a bit more content over the next week or so, and you can see if you think that you could benefit from improving your skills with these amazing little silicone cups. Have a great day.